What is the Micturition reflex and urethra function? The Micturition reflex is an important process that helps us urinate. It involves a series of signals between the bladder, spinal cord, and brain. This reflex is essential for bladder health, as it ensures that urine is stored and released properly. Let's break down how this reflex works. When the bladder fills with urine, its walls stretch. This stretching activates special sensors called stretch receptors in the bladder wall. These receptors send signals through the pelvic nerve to the sacral region of the spinal cord. From here, the signals travel to a part of the brain called the pontine micturition center. This center is responsible for coordinating the actions needed for urination. Once the brain receives the signals, it triggers the contraction of the bladder's detrusor muscle. This muscle is what helps push urine out of the bladder. At the same time, the internal urethral sphincter relaxes, allowing urine to flow into the urethra. The urethra is a muscular tube that carries urine from the bladder to the outside of the body. It plays a crucial role in urination. Surrounding the urethra are sphincters, which are muscles that control the flow of urine. The internal urethral sphincter works automatically, while the external urethral sphincter is under our conscious control. This means we can decide when to urinate. Understanding the Micturition reflex and the function of the urethra is vital for maintaining good bladder health. If there are disruptions in this reflex, it can lead to conditions like urinary incontinence or urinary retention. These issues can arise from various factors, including age, neurological disorders, or even bladder cancer. In the context of bladder health and bladder cancer, knowing how the Micturition reflex works is crucial. Bladder cancer can affect the bladder's ability to store and releases urine effectively. This can disrupt the normal functioning of the Micturition reflex. Treatment often aims to preserve bladder function while addressing any cancerous changes. By understanding how these systems work together, we can better manage bladder health and respond to any issues that arise. Always consult a healthcare professional for personalized advice and treatment options regarding bladder health.